and welcome to One Healthy Boston's Facebook Live. I'm Kristen Perfettio. As we round out 2019 and we look ahead to 2020, perhaps you're reflecting on your health. And do you have a good primary care provider? Well, that someone might be, do they listen to you? Do they advocate for your health? That's our topic of discussion tonight, and I am joined by Dr. Leyda Delgado, who is an internal medicine doctor at South Shore Health. Dr. Delgado is going to try to answer some of our questions tonight about choosing a good primary care provider, whether or not you should be asking certain questions, and that type of relationship that you should be fostering and developing over the years with your PCP. It's very, very important. Dr. Delgado, thank you so much for joining us tonight. I appreciate you making the trip here.
Thank you, Kristen. It's a pleasure for me to be here tonight with all of you and our audience there in Facebook.
Yeah, we want to actually encourage our folks at home to send in any questions regarding primary care. If you're looking for a PCP, perhaps you have some questions that you want to ask Dr. Delgado about what to look for, who to choose, how do you know when it's the right fit. So please feel free to send in your questions this evening. Dr. Delgado, I want to talk about PCPs. So you hear this acronym a lot, PCPs. It is a primary care physician. What exactly does a PCP do?
Yeah, so primary care provider or primary care physician, if we want to be more specific, is somebody who's medically trained to deal with chronic long-term diseases and at the same time focus with prevention. And it's that relationship starts early on in childhood or when your child is born, all throughout your life. So this is going to be your key person, your guidance, the point person, the beginning of a new journey that you're going to bond with our patients.
So many people are very quick to say like, oh, it's just my doctor. But it's more than that, right?
Definitely is a relationship that you build for life. A relationship that is based on trust, is based on knowledge. And as time goes by and there's so much media, we know that our patients are well informed, very well educated, and it's a team. It's my patient with my team, not only the doctor and the patient, is the whole team.
Gotcha. There are so many different elements to choosing a PCP or different kinds of primary care providers. And what I'm talking about is, do you choose a family medicine doc? Do you choose an internal med doc? What about a pediatrician? Talk a little bit about those different specialties. What are they and what's the difference?
Yeah. So we identified there's 5 different types of primary care providers in general. It all depends in what is the stage of life that you as a person need and what are your needs at that point in time. So we know that pediatricians are family medicines, are primary care providers for children, since you have a newborn throughout usually 16, 18 years old. Then you have, if you are a female, you can have an obstetrician gynecology be your primary care provider throughout your reproductive years. Okay. Then you have what we call family medicine, internal medicine, which are trained more specifically internal medicines to treat with adult patients throughout their life. And then we have family medicines, which have a special training starting with newborns throughout elderly patients. And finally, there's a subspecialty, but it's also part of what we call primary care, which is geriatrics. It's internal medicine physicians that so specialize in treating patients older than 65 years old and treating their chronic diseases.
Okay, so can someone who just had a child, for instance, can they choose a family medicine doc right away? Or is it best to start with a pediatrician and then make that change to family medicine as their child gets older?
Definitely somebody who has a newborn, they can choose. They can choose right from the get-go if they want a pediatric doctor to have the primary care provider of their newborn, or if you want a more family-oriented approach, not only taking care of the newborn, they want to make the family part of that whole, system, you can also choose a family medicine.
Okay, and then same goes for someone who is aging, if you will, family medicine or internal med. They may want to switch over to do you call it geriatrician?
Correct. Exactly.
Okay.
We call it geriatrician if there is more specific needs that that patient need at that point in time, especially related to what would be the needs long-term, short-term. Usually that's when people decide, or there is like a chronic disease that you want a subspecialty dealing with the patient. That's when probably the person will switch from family medicine, internal medicine to a geriatrician.
Okay. OBGYN, is that also considered primary care physician?
Correct. Obstetricians, gynecology are primary care providers of females throughout their reproductive life. Sometimes that's a very important question because patients says, do I really need to have an internal medicine if I have my OBGYN? If you have other medical issues apart from your reproductive issues, it's good to have internal medicine, family medicine that can see you more chronic diseases that can follow more broad, more broad categories of issues.
Okay, interesting. We have a question at home from John, and he asks, is it more important to pick a PCP that is closest to your home, or is it better to be closer to your place of business? We get that a lot.
Yeah, definitely. That's a great question because that's actually one of the most important 3 factors in order to choose a primary care. It depends on your needs. I usually, counsel the patients that if you spend most of your time at work, it's better to have a primary care provider near your work because it means that logistically you're gonna avoid traffic. Your availability of that office will be just near you. If that is not that important, then you can choose some system that is near your home, and especially depend on your age, because if you're elderly, you don't drive, and you want something closer to home, you will pick up primary care within your radius of your home.
Okay, I definitely hear that happen a lot with women who are pregnant and are working in the city or wherever or close by to a doctor's office. They want to pick a doctor that's closer to work because they have such frequent visits. So that would make sense.
Yeah, definitely makes sense. Definitely.
Okay. We've talked about the distinctions between geriatrics and pediatrics and internal meds, but what factors should someone consider when searching for that primary care provider? You just touched upon a little bit about logistics and location, but what other factors should they be looking for?
Yeah. The most important thing, we're in Massachusetts. We are blessed with an amazing and huge system that have many choices for patients. But one of the most important crucial things is what insurance do you have, what primary care providers are within your network. Because once you know that that particular primary care is within your network, you can walk through the system and it's going to be flawless. You're not going to have problems with insurance, referrals. Can I go there? Can I not go there? So that's one of the major, I would say that that's your first step in order to get a primary care. What would be the primary care within your network? Number 2 would be what we just mentioned, logistics. What do I need? Do I need something closer to home? Do I need something closer to a major medical facility because I have a lot of chronic conditions and I don't want to travel? And number 3, how comfortable you feel with that provider. And that's one of the most difficult ones. In this age of social media, we have tons of videos, we have tons of profiles that you can go and get a sense. Do I, a little bit of how would be that personality of that physician? Would I think that it will match my needs? And the biographies and profiles that will tell you, do I need a provider that speaks Spanish? Do I need a provider that speaks Portuguese? So I would say that those 3 major components would be the number 1.
Okay, so it really is about doing some research beforehand.
Yes.
And those folks who don't have access or choose not to use the media to make that decision, is it I shouldn't say impossible, but is it not really normal for someone to go to an office and schedule maybe a interview with their potential PCP? Has that happened?
Oh, totally. We, those patients who doesn't use media, they use their references, their family members, word of mouth, the colleagues at the beauty salon. So that's how we get more references, by word of mouth. Then some people definitely schedule an appointment, meet and greet, just to see if they get a sense if this doctor gonna meet my needs. Do I feel comfortable? Do I like the office? Do I like the parking? If this has urgent care that will meet my needs after hours. So definitely that's another way of doing it.
And also availability, correct?
Totally. We work as what we call a primary care team. When patients enroll into a specific medical network, not only in this A&H, you don't only think about is the physician. We have what is called advanced providers, advanced practitioner clinicians, which are nurse practitioners and physician assistants that are part of the team. So that enhances the availability that that patient will have to meet their needs.
So it's not always, if they can't get an appointment with you per se, they're definitely going to be able to see someone in that office, nurse practitioner or another doctor.
Absolutely.
Okay, wonderful. So how do you know when you have found the right doctor?
It's very interesting. You find the right doctor when you can be honest, when you can do not feel ashamed of asking any types of questions, and you have a doctor that is also honest with you, that is willing to work no matter what your chronic condition is, that the doctor shows some empathy and will work with you no matter how difficult your issues are, that it will not give up. And if that doctor doesn't have all the answers, he's going to guide you. He's going to refer you to people that can help you.
Okay. All right. We have a question from Helen at home, and she asks, if I plan on having children, what should I consider when selecting my PCP?
Well, when you have children, it's very interesting, because I always think that you want a PCP that matches kind of your age range. That will be one thing that is important. Somebody who's going to be empathic with your needs as a mother. It also means logistics closer to home. You're going to be a new mom, and basically you don't have that much time to go across 1 hour drive to see your doctor. So I would say that logistics is important. And if you feel that there is a doctor that meets your need, and I don't want to say me too, but gender sometimes for some patients is important. Okay?
Yep.
So I think that those three factors, you will consider more.
Okay, we do want to welcome our viewers at home to send in their questions. This is Dr. Leyda Delgado. She's an internal medicine doctor at South Shore Health, and we are talking about choosing a primary care physician tonight, how important that is for you, because it really is a very important decision in your life. We have a question at home from Joanna, and she wants to know, I feel that my current PCP is always rushing during my appointments. Is it okay to say something?
Definitely, absolutely, yes. I have been doing primary care for 20 years, and one of the things, unfortunately, is the demands that we all have in how we, run our schedules. And it happened to me all the time, I would say, and the more feedback I get from my patient, then that's for me to step back and think about, okay, let's prioritize. And if the patient tells you, okay, doctor, I feel that every time you're rushing me, we say, okay, for next visit, what we're going to do, you're going to write what are your 3 top priorities. We're going to discuss that, and then we're going to not rush it. And then at the end, we're going to wrap it up and see what it's the plan that we have. But if you go for a follow-up appointment that is only scheduled for 15 minutes, expecting 10 things to be answered and done, is a little bit, it's really, really hard.
Okay, so then if you discuss those 3 things, coming in with a plan about what to talk about, and you're not getting to those other 5 or 6 things that are bothering you, schedule a follow-up? Is that what you should
can
be doing?
schedule? There's 3 things that you can do. You can schedule a follow-up. Number 2, you can write a letter or a paper to the doctor, and the doctor would get back to you, within reasonable time. And number three, the most powerful thing that we have, social media. I know that social media is used more by the computer savvy people, but it's a way that we can connect right away, especially because we as primary care spend so many hours in our computer, and immediately it's like a text message.
Okay.
I get the question or the concern, and within a reasonable time, most of us in our practice answer that patient within 24 to 48 hours.
Okay, so you're talking, when you say social media, you're talking about email.
Okay. Email and some tool that we have that is called My Chart, My Health, depending in which practice you are.
Gotcha. That makes sense. So that when you talk about social media too, I get a little nervous about the whole idea of Googling. Okay, my doctor and I didn't talk about this, but now I'm going to Google.
No, definitely no. We respect your privacy. All medical concerns are private. So it's through, HIPAA regulated, secure systems that we do that type of communication. So that's very important to make that, little note, because definitely we respect our patients' privacy, and we don't want to disclose anything in social media. So
okay, terrific. Getting back to the how do you know that you found the right doctor? You brought up a really good point about patients feeling, or at least being able to disclose or be open and talk about sensitive issues. It's uncomfortable sometimes talking to a stranger, if you will. Talk a little bit about how important that is, that you develop that trust and that people do be honest with their PCP about what they're experiencing.
Yeah, totally. Like I said, the more honest you are with your provider, the better you're going to work as a team. And I can personally tell you that for me, the patient that just right from the get-go is able to open and disclose themselves. I have, for example, an alcohol issue. I have a opioid issue. We're trained for that. That's what our life was. We spend, most of us, 10, 15 years training, and as much experience that we get, we're there to listen. And when a patient discloses, it opens my heart. It opens my heart for a way of communication and understanding and an empathy right from the get-go, rather than waiting a year, and then you have to give some kind of therapy that is not working. Why? Because it may be interacting with one of the substances that the patient is using. So I think, that's key to try to get it on the get-go. But I also understand that if they don't feel comfortable with the provider, nobody's going to open right away. So it's a two-way.
Okay, good advice. What are the benefits? Well, you just talked a little bit about that right now, of having a strong relationship with your PCP. There's so many benefits to that people can take home with them.
Yeah, totally. I would say by experience, one of my patients is in the emergency department with some kind of issue. They call me, oh, I know her, don't do that, don't do this, don't admit her, I know her, this is how you're going to treat, I know her daughter, let me call her. So is that kind of relationship that every adult wants to form and wants to have, not to go to 3 phone calls, different 10 doctors to find out what's going on. And like I say, it has to be a relationship that's formed early on as an adult, because and knowing the other family members, who is the daughter, who is the kids, who's the grandmother, and that's one of the important things. That's one of the beauties that I found being a primary care.
Excellent. Tony at home wants to know, is it a good idea for a husband and wife to share the same PCP?
I think yes. I think that we are trained it's like a priesthood, right? It's a priesthood. You owe to your patient some, respect. You owe to your patient what is called information security. So that's what family medicines do. They usually take care of the whole family, husband, wife, and children. So I think that as long as you trust that provider, it can be done, because we are trained to, be like a priesthood.
I love that. I love that description. The other thing that I wanted to ask is, how important is it that your PCP stay on top of the latest medical research and know, I mean, things are always changing. Healthcare is constantly changing. New guidelines for colon cancer, new guidelines for breast cancer. You want a doctor who knows the latest, right?
Yeah, definitely. When that's one of the beauties again of being in a health system that provides for the physicians to be constantly doing what is called continued medical education. We have to have every year certain hours, certain credits that we are going to be updating, in our department. Our chiefs make sure that we all get that trained constantly. We go to meetings once a month, that there's always the latest topic being discussed in what's in the news. We participate as part of the different associations, American Medical Association, with their websites that we get the news, what's the latest in our application. So we immediately know, okay, this is what is current. There is an epidemic. For example, when the measles happened a couple of years ago, immediately the next day, our chief of infectious diseases was sending a whole email. These are the steps to follow. So when you are part of an organization that is so well structured, that's part of the responsibility of all of us as physicians to maintain the currency of our knowledge.
So you just brought up a really good point, actually. In choosing your PCP, it's not necessarily even choosing that individual. It's also looking at the system that they're coming from, whether or not there are other people within that system that are support services, resources, the team, if you will,
Correct.
that you should be looking at.
Yeah, definitely. One thing that I see it all the time is having services within the same radius, within the same area, within the same building. Especially to our elderly population, they love it when I say, okay, you're going to have your pulmonologist, you're going to have your cardiologist next door, 2 doors from my office. So it's also very important that you choose a solid health network. In Massachusetts, there's amazing health networks, from like safety nets to more sophisticated nets. Patients have, the opportunity of the choices there.
Wonderful, wonderful. Sarah wants to know, I just found out I need to find a new PCP, but the PCP I want to select is not accepting new patients. Is it okay to still inquire if she'll accept me?
Well, it's very interesting. We know that what happens is physicians, it's like a cap. Once physicians get like a whole number of patients, imagine, it's amazing to get into a new patient appointment. And it's also a safety kind of concern, because that means that you can get an initial appointment for the patient with a physician, but then that doesn't guarantee you that if you have an emergency, it's going to be the doctor that you choose seeing you all the time, because maybe you have to wait 6 to 8 months to see that physician. So it can be done. Of course it can be done. Communication is the key. If you talk, okay, I want you to be my doctor, my sister have you, we love you, but it's just availability. What we want to guarantee the patient access.
Okay, good tip there. How important is it? We've talked about this before. There are some people who like to be told by their physician exactly what to do. And then there are other people who really like a collaboration with their PCP. So how important is it to find that person who matches your style with being treated?
So that's it, it's like, again, personality. Okay. I mean, it's like you like what you hear. Like patients have told me, they come to the first visit, they look at me, I go and I talk la la la, and I say, if I'm talking too fast, let me know. Oh no, you're perfect, I understand your accent. And at the end they told me, oh, I like what I see, I want to keep you, I like you, I feel comfortable. If you are quiet and you don't give any feedback, it's going to be very hard to know what the doctor wants. But I think after the 2 or 3 visits, you got the patient, and I think the patient gets to know you. You see, you explore, okay, this is the kind of person that she will follow 1, 2, 3, what I tell her, and I respect her and she respects me. And this is the patient that is going to email me all the time with all their different concerns, and that's also okay. So there's no right or wrong.
Do you find that it's also generational too? Do you find that
totally. Definitely, the millennials, that we call it, or young patients, they are not afraid of, saying what they say, but definitely it's a generational thing. But not right or wrong.
Okay. Also, let's talk a little bit about, should patients be very aware of whether or not their doctor is engaging in their decisions, is really listening, tuned in, hearing them out, not making them feel, we talked about it earlier, rushed, I'm only under a certain time. Those are some things that they should be really in tune to.
Yeah, definitely. It's just that I know that what happens is when patients come to the primary care, they also come with questions about other subspecialties. And they want you to answer, to explain tests. They want you to go over other specialty results and consults. So, like I say, prioritizing is the key for you to feel heard. Is the key for you to know this is what we're going to talk. And if we don't have time, why don't we either talk on an email, because it's much easier for the doctor to be more explicit on an email, or we make a follow-up and discuss these topics. It also happens with family members of elderlies that they want to talk to the physician ahead of the office. So we can do that, all of that, but it has to be, with a priority list.
Gotcha. We have a question from, I'm sorry, Guatam. I think it's Guatam, and I apologize if I did not pronounce your name correctly, but what would be your advice to patients who are running late for their appointments? That's happened a lot.
Totally a lot. So, it depends on what is the time that we're talking about running late, okay? Usually, in general, most medical appointments, new patient appointments, are half an hour. And then, depending on the site, then a follow-up appointment is 15 minutes. If you are already late for your first appointment with your first doctor, you don't know the doctor, and the appointment is gone. So you have to call the office, ask, could the doctor please book me? I know I'm late. Could we reschedule? Does the patient can, the office is definitely very open to work with you. But if you show off and if already the time is done, gone, and there's other appointments waiting that are on time, I think it's fair is fair.
Gotcha. That makes sense. Tracy wants to know, my PCP is an APRN. I've never heard of that. Is this the same as having an MD?
So that's what I was referring to at the beginning of the interview. We have the advanced provider clinicians, which are nurses or physician assistants that have some years of training, and they can be primary cares. They can become primary providers. So they can do the same role as a physician because they have some form of training as a physician. They can administer preventive tests. They can order your mammogram, do pap smear. So they can do the routine preventive care. But if there is more complicated or chronic issues, that's when sometimes it's transition. But if you're a healthy young female that just go for routine physical exams, it's completely okay, and they are well trained here in the United States.
Okay, and I do have one more question. DO, you see MD. What's
Correct.
the difference between that as well?
Yes. So it's very, MD stands for medical doctor. OD is osteopathic degree. There are two branches of medicine that OD started in the 1800s with the same philosophy of the traditional medical doctor, but over time they were kind of like specializing more in musculoskeletal diseases. But over the hundreds of years, both branches that started like in two different pathways, they both, meet and intersect. So it's just osteopathic medicine, but it has the same years of training that a medical doctor. They have to pass the same kind of boards that we have to pass, in the same years of training. Okay, so it's a different, I would say, historical approach.
Gotcha. Interesting. We just have a couple minutes left. We know if there's one thing you want our audience back at home to learn from tonight or take away from tonight, what would be your advice, or what's your key takeaway?
My key takeaway is, do not wait until you get sick to get a primary care. It's good to start that relationship, especially because in the state of Massachusetts, most of us, everybody is required to have a health insurance. And at least once a year or once every 2 years, you have somebody that would advocate with you, maybe not now because you are healthy, but maybe in the future. And it's nice to know that person, to know the system, and don't be afraid to ask questions. Even if the doctor is rushed, give feedback. We need the feedback, even if it's not what we want to hear, but we will be listening.
Awesome. I want to say thank you so much for joining us tonight. You're always such a pleasure to talk to.
Thank you, Kristen.
Just so enjoy talking with you. We want to thank all our viewers at home who sent in their questions tonight. We definitely had some good ones, and we hope you can take away some great things. If you missed tonight's segment, you can catch it all on onehealthyboston.com. It will be there. And you can also visit on WCVB TV's Facebook page as well. Thank you, everyone, for joining us, and we will catch you next month.